Mabuhay, future nurses! Welcome to Pediatric Nursing 101 with me, your student nurse, Edmond. In this video, I will be having a written demonstration about breastfeeding. As we all know, breastfeeding is one of the most important procedure after pregnancy because it provides the needed nutrient of a newborn. So what are the different indications or considerations when having breastfeeding? First is that we should not separate the baby to its mother unless otherwise there is a medical emergency. Second is do not give sugar, milk, formula, or other pre-lacteals. Third is that do not give bottles or pacifiers. Fourth is do not throw away colostrum. Fifth is if the mother is HIV positive, we have to counsel them regarding the risk, and we have to give them options regarding breastfeeding. We have also to tell them the transmission of the infection of the virus via breastfeeding. So without further ado, let's get started. So the first procedure that we have to make sure is that we have to wash our hands. We have to make sure that the mother is in relaxed and comfortable position. And then we should not hurry the mother when having breastfeeding. Let us allow some bond between them. So wag nating madaliin ang pagpapasuso ng ina sa bata. There is no time range ng pagpapasuso. As long as hindi pa satisfied ang bata, we can go on with breastfeeding. Let us assume that I am a nurse educating a mother regarding breastfeeding. So the first thing that we have to do is that we have to make sure that the mother is in a comfortable and a relaxed position with her body and arms supported. So I place a pillow underneath the arm of the mother to support it, and then before we start breastfeeding, we have to make sure that the baby's body is aligned to her, as the baby's head is aligned to her body, and her abdomen should be turned towards the woman, making sure that the head is not flexed or twisted. Hindi nakaganon at hindi din nakaganon in order to prevent injury. Now, we have to place the newborn's mouth near the nipple to begin sucking, but we have to make sure that his or her nose is placed opposite to the nipple. Why? The rationale behind this procedure is that placing the newborn's nose opposite to the nipple allows actually the newborn to breathe during breastfeeding. And then we have to hold the baby's body closer to the mother, and we providing support not just on the head, not just on the neck, not just on the shoulder, but to the whole body as well. Okay? So we have to bring the infant closer to the height of the nipple. Now that we are done with the proper positioning, we should now be learning the proper holding. So doing the same procedures similar a while ago, we will be putting our hand into the breast, 4 fingers underneath the breast, and the thumb on the upper part of the breast. So doing this kind of procedure ensures that the nipple and the areola is pointing towards the baby's mouth. So, or we can do is that we have to put our fingers and our hand just underneath the breast while we bring the baby's head close to suck. Okay? So how do we know that the baby is having good sucking and good attachment? So we have 4 cardinal signs. The first sign is that the chin is actually on the mother's breast. The mouth is wide open. There is more areola skin on the upper part rather than on the lower part of the breast, and the lower lip is curled back on the base of the breast. And we still have 2 additional cardinal signs. So the first part is that the baby takes shallow, deep sucks with some pauses. And then, breastfeeding is not a painful procedure. Therefore, mother should not be feeling any pain when doing this kind of procedure. Now, if the mother complains of having any pain, we have to tell the mother to reposition the baby, to reposition the newborn, because painful breastfeeding is an indication that you are not in a proper breastfeeding position. So we have to tell them to reposition themselves. And then, how are we going to terminate or end breastfeeding? So the first is that if the baby let go of the breast, then we can stop breastfeeding. The mother should not pull out the breast, kasi habang hindi pa binibitawan ng bata yung suso ng ina, ibig sabihin hindi pa siya tapos, hindi pa siya satisfied. And then if we palpate the breast, it is softer at the end of breastfeeding rather than firm on the beginning of the breastfeeding. Now, if the baby fell asleep and let go of your breast, then it means that the baby is already satisfied, and that's the time that we terminate breastfeeding. So, here. So this is how we perform breastfeeding to a newborn. Thank you and have a good day ahead.